The areas where patients are at higher risk of cancer mortality, just on observation, seem to overlap with areas where there are high risks of future climate change impacts. And so our goal was to see to what extent one could tease out these relationships. And so what we did was we um, uh, evaluated the counties that represented the top 25% in the US of cancer survivors in the high cancer mortality areas. This is about a little bit more than half of all counties. And our aim was to evaluate just what kind of future climate change risks those patients are going to be vulnerable to, and to identify them and compare their vulnerability between those counties and those counties where there were not high cancer mortality. Well, we built a risk model. We did a test and validation approach with some cross-validation. So first of all, we evaluated a number of different factors, about 40 different factors, to see which climate factors might be especially prevalent for patients in high-risk counties. And we identified 6 of them predominantly, and we validated them. And those factors are extreme weather events like tornadoes, hurricanes, high precipitation. They are economic impacts, climate cost impacts, as well as air pollution. And so these 6 factors together, when you build a model, you can identify that the counties in which patients are at high risk of cancer mortality are going to experience a substantial impact from these factors in the future. The implications are, this really points the way for future evaluations of how future climate change risks in vulnerable cancer populations can impact patient adherence to treatment, patient tolerability, patient morbidity, and even potentially patient mortality. So it sort of points the way to future evaluations, analyses, and hypotheses. I just want to thank my dad, who is a climate change advocate, for this idea in part, and I credit him.